All right, guys, so this week in lab, we're doing the integumentary system. So skin is our largest organ. It covers us from head to toe, and it needs to be inspected when we're doing our head to toe assessments. You guys are gonna incorporate it into your other systems, but for today's video, I'm just gonna go through and do an integumentary assessment. So we start with asking a few questions. First of all, hand hygiene. I would introduce myself to the patient. Hi, Mark, I'm Connie, I'm gonna be your nurse. And then I would get a brief history. So do you have any skin conditions?
No.
Rashes, new moles that have appeared, skin tags, anything like that?
No.
No bruises?
No.
All right, so you get a quick health history and then you start with your inspection. So we always inspect and then palpate. There's no percussion or auscultation associated with this system assessment. So we're just gonna inspect and then palpate. So I'm looking at his face. I'm looking at the skin on his face. I'm trying to make sure that it's consistent with his ethnic background. You're also looking at the scalp to see what the condition of the scalp is. So you want the scalp skin to be pink, to be healthy, not dry and flaky. You don't want any kind of yellow scaling associated with it. But you're also checking the scalp for any moles or any abnormalities in it. So I'm just gonna touch your head if it's okay. All right, so the head is nice and round. The skin on the scalp is nice and pink. I don't see any dryness. The texture of the hair is smooth. It feels moisturized. It feels healthy, not brittle, and it's soft. Skin on the face is even, consistent with his ethnic background. There is a few hyperpigmentation spots on his cheeks, which can be normal with our older adults. Did you spend a lot of time in the sun?
Yes.
So checking over to make sure that there's even hair distribution. So eyebrows are present, eyelashes are present. You can see where he's shaved that he has an even facial hair pattern on his face. As we move down the neck, I'm just gonna untie your gown if that's okay. All right, so as I'm moving down, I'm looking at the skin on the neck. Again, you're looking for the exact same things. Hyperpigmentation, loss of pigmentation, any moles, bruises, lesions, anything that would be abnormal. When I get to the clavicle, I can check turgor of the skin. So you're pinching it up, trying to make sure that it doesn't remain tented and that it goes down. The moisture level of the skin is great. As we move through the body, we always compare bilateral. So we need to get a temperature of the skin. Our palms aren't as sensitive as the backs of our hands, so we use the back of the hand to check for temperature and moisture. So I'm just working my way, sorry, I'm just gonna slide your arms out if that's okay. I'm working my way down the skin, checking bilaterally for temperature. The skin is warm, it's dry to touch, so it's not sweaty, but it's not dry and flaky either. There's some hyperpigmentation in the shoulders and the top of the chest. Bottom of the forearms is a little bit tanned, but we've come upon spring and you spend time outside. All right, so checking over the overall health of the skin. It looks healthy, it's all intact. I do see you have a wound here. Do you have a cut under there?
Yes.
All right, so a cut noted under here. The assessment of that will be done when you do that dressing change. I don't see any shadowing. It does not look red around the tape. So I would assess what's underneath that dressing when I do a dressing change. We don't take dressings off and on like just for fun. We wait until we follow the order, the wound care order. So I'm not changing that right now, but I'm assessing the skin around it, making sure that the umbilicus is midline. Even hair distribution on his tummy, which is normal for a male client, also normal for a female client. So you want to note that body hair is normal as long as it's evenly distributed and there's not patchiness. Cover him up to keep him warm. As I move down the body, checking his arms. So I don't notice any abnormalities in the skin, but you are checking and touching each piece of skin. So you're not just assuming. When we get down to the hands, we're gonna check the nails. So you're looking for an intact nail bed. You want the nail bed to be pink. You can push on the nails, no ridges. It should be a nice smooth curvature, but not clubbed. So they need to just have that kind of normal curvature to them. A little half moon in the bottom is a normal finding on a nail. His nails are strong, they're not brittle. I don't feel any ridginess to them. They're long-ish, but that's nice because I can see that they're not brittle. They're just the right thickness. They look like they're good, healthy, strong nails. I would come to the other side, check that other arm, which for the sake of the video I won't do, but you would go through touching and inspecting that arm, and then we need to compare bilaterally for temperature. So the temperature of both arms is even. Same with on the legs. You're going to inspect the skin. You're looking for that even hair pattern, hair distribution. You're looking for anything abnormal. So any moles that have ridgy edges that aren't nice and circular, anything that's new to the patient, bruises, skin tags, lesions, things like that. Even hair distribution is noted to both legs. And then again, checking that temperature of the skin bilaterally to make sure that it's even, which it is. Can I get you to just roll to your side? I'll actually get you to come to my way. All right, so we worked from top to bottom, front. Now we need to do the back. So I would come around to the other side of the bed, and I would be checking the back to see that the color is even, there's no moles, skin tags, bruises, lesions, breaks in the skin, anything like that. So you're gonna go through and check the back. You would check bilateral temperature. The back side of the legs is also really important. So heels are a big spot for skin breakdown. Tailbones are a big spot for skin breakdown, and hips can be a spot, especially in our older adults as their muscles start to atrophy and the bony prominences start to stick out. So you need to actually visually get a visual on all of these spots, okay? It's not okay to just look at the top of the leg and not check the heel. So recognizing that anything that pushes down is prone to breakdown, you wanna check that. So I would work through the back, inspecting, and then palpating along the back, and then note any abnormal findings. You're gonna document them, write everything down, go through, fill out your sheet with everything that you find. And that's Integ.